David Rowan is the editor of Wired UK. What is Wired UK, David?
It's a magazine, Steffi,
It's
about
a magazine.
the innovators, the people trying to change the world.
Absolutely, and I really recommend to read it. It's on a monthly basis.
It's on a monthly basis, and there's an internet site, and we do these things called apps. And I come to DLD Women and come away with stories. So there's a whole bunch of stories that we told based on the people who were speaking last year. We did an 8-page piece on John Coates. You remember the testosterone researcher?
Yes, of course. I invited him.
So everybody here has a story. I'm sure we'll be talking about it as we meet in the day.
And what is your story?
Personally,
Sure.
curiosity and never quite giving up if there's something fascinating and kind of pursuing doggedly to work out actually what makes something tick.
Good. Good. Good role model.
It's called journalism. It used to have a business model, but that's all changed.
Good. So what are you bringing us today?
So I know everybody's in their mid-afternoon slump, and we're all a bit hot, but this is actually a pretty important, pretty inspiring session, because it's about the optimists who have a mission to change life for billions of people. It's how helping women in particular helps change the world. And our first speaker, we're going to have a little panel discussion in a minute, but we have a speaker who has an extraordinary role. She is the Chief Communications Officer for the Bill and Melinda Gates Foundation, which is the world's largest private foundation with an endowment of $36 billion. And when you've got $36 billion, you can really make a difference. It's prioritizing things like enhancing healthcare, how to reduce extreme poverty, expanding educational opportunity, and they measure results. They're very data-driven, as you can imagine, coming from the background of Microsoft thinking. And I would like to welcome, just to give an overview of how the Gates Foundation is helping women in particular, but is making a difference. Please could we welcome Kate James.
Thanks very much. I think that was a case of being here just in time, literally. Thank you very much for that exceptionally kind introduction. So I'm conscious that perhaps many of you in the room aren't familiar with the foundation. We're driven by the belief that all lives have equal value. And as the introduction said, we focus on a wide range of issues. In the US, we work largely on education, but across the world, we work on some of the biggest development challenges, from the eradication of polio to helping millions of small farmers out of poverty. And I wonder, when you think of the word farmer, what do you see? Do you see a man or do you see a woman? Because the reality is that the bulk of the smallholder farmers that we and our partners are trying to help are in fact women. Women and girls are at the heart of the solution of so many of the issues that we're working on. And the smallholder farmer example really bears that out. If you take a male farmer and a woman farmer and you give them access to exactly the same tools and technology, a woman is likely to be up to 30% more productive than her male counterpart. That's a huge impact, not just for the woman, but for her family and for her community. In my role, I think a lot about the perceptions of development. I think a lot about how all of us picture development issues, particularly this audience. You're all influentials in your own space, whether it's media, government, technology. Now, why is that important to the Gates Foundation? Well, take another issue that we work on, malaria. When you think malaria, what do you picture? Do you see a mosquito? Do you see a bed net? Do you see a sick child? Or do you see a happy, healthy child that has had access to all the tools that are available today to prevent that deadly disease? Because that perception is important. Because if you see the happy, healthy child, you believe that we can make progress in development. And that's important for us, because we need to be able to generate support on a global basis and support that we can sustain, because the issues that we work on are tough and they're not resolvable in weeks or months. They often take years or even decades. Melinda Gates was here in Berlin last May. She's a huge champion of women and girls, and she was here in Berlin to announce that she would be championing family planning, not for weeks or even a couple of years, but for the next 30 years. And last July, she came together with other partners, including the UK government and the German government in London, to make a major commitment to family planning, to provide access to family planning services for another 120 million women by 2020. A huge commitment. So why is that so important to us? It's important because we believe that access to family planning services is transformational. It enables women to redefine their futures. If you think about a woman in the developing world being able to space her kids every 3 years, by doing that, she can reduce child mortality by up to 25%. If we can reduce the numbers of unintended pregnancies, then more girls will be able to complete their schooling. Currently, in sub-Saharan Africa, up to a quarter of all girls drop out of school because of unintended pregnancy. And yet, if they complete their education, we know that they're 2 times more likely to send their own daughters, their own children, through school. One of the important things that we focus on is how do we develop global momentum? How do we build a global conversation about development issues? How do we elevate new voices, particularly those from the global south, so that when the global community makes decisions about development, it's informed by the people on the ground who are actually impacted by those decisions? And that's why, at the Family Planning Summit last July, Melinda invited a lady called Jane Otai to share the stage with her. I've been fortunate to spend time with Jane. She's a passionate advocate for family planning services. She grew up one of 7 children in one of the poorest slums outside Nairobi in Kenya, Kibera. But she credits having access to family planning services as one of the main reasons why she was not just able to complete her education, but to go on and earn a master's degree. And she's now back working in Kibera on urban reproduction to ensure that future generations of girls growing up in the slum are able, like her, to shape their own future. As we think about developing this global conversation, social media, of course, creates for us a huge opportunity. And we're particularly interested in how women use social media. We're looking at lots of different opportunities at the moment as to how to engage women on social media, whether it's working with our partner Catapult and developing an online crowdfunding platform for women and girls issues, or it's a partnership with the United Nations Foundation on a campaign called Shot at Life. Shot at Life aims to build awareness and understanding around vaccines. Vaccines are the most cost-effective prevention for childhood death in the developing world. And Shot at Life focuses on galvanizing mom bloggers. Mom bloggers have been incredibly active in the US. To give one example from the campaign, last August, they ran a relay of blog posts, a different blogger posting each day on vaccines. Why was that so interesting for us? Well, actually, it was less the blog posts, and it was more the comments that were being generated. And with the United Nations Foundation, we committed that for every post, for every comment that was posted, we'd make a $20 donation. Why $20? Because $20 enables you to protect a kid against the 4 biggest killers of children in the developing world. 10,000 comments during that month were generated, 10,000 lives protected, but also 10,000 comments that helped ensure that we generated a conversation around vaccines for the whole of the month of August, and 10,000 comments that helped to strengthen and deepen that community of mom bloggers. A community that I'm delighted to say is alive and thriving today. And in fact, only 2 weeks ago, we hosted a Twitter town hall with them on newborn health. And for the first time ever in the US, newborn health trended on Twitter. So, I want to leave you with one last thought. Development, as I've said, is an incredibly complex concept. How all of us view issues of development is really important. Do you view development with apathy? Do you think that these issues are just too hard, too difficult to tackle? Or do you view them as we do, with huge optimism that we really can make progress in this space? And it's an important question for you, because all of you can help shift that conversation on development and make it one of progress and optimism. So, one last picture for you. When you think of family planning, what do you think? Do you see it as a non-issue, as a readily available box of pills on a shelf in a pharmacist that all of us can access? Or do you think of Jane O'Tighe, a passionate advocate for family planning, who was brought up in desperate circumstances, but because of her access to contraceptives, is now able not only to redefine her future, but to redefine the future of generations of girls to come? Thank you very much.